Hello, today I'm going to be talking about the pathophysiology of preeclampsia. So, by definition, preeclampsia is a progressive multisystem disorder that consists of hypertension, proteinuria, and multisystem organ dysfunction. These indicators present after 20 weeks of gestation or during the postpartum period. So, for hypertension, we are looking for 130 over 80. The old threshold for preeclampsia concern was 140 over 90. However, now ACOG is using this newer, lower blood pressure threshold. For proteinuria, we are looking for 200 milligrams or more of protein in the urine. And this really is just an indicator that the kidneys are damaged and leaking protein into the urine. So that leads into our multisystem organ dysfunction concern. Um, Typically, when providers see multiple systems being affected, it's a pretty good indicator that preeclampsia is developing. So typically, the organs we see affected first and foremost are the kidneys, liver, and the brain. Preeclampsia has a couple of different classifications. So we have just classic preeclampsia, new onset of hypertension and proteinuria, or new onset of hypertension and this end organ dysfunction. Um, when we say preeclampsia has severe features, we are looking for one or more of the following. It could be the central nervous system dysfunctioning, which looks often like a headache and vision changes in individuals. We may see impaired liver function, which would present with upper right quadrant pain. We can also test for low platelet count and kidney dysfunction, which we talked about with the proteinuria. Superimposed would be a term used for diagnosing a patient with preeclampsia who came into pregnancy with chronic hypertension. Um, so it's a little bit difficult. The diagnostic criteria is a little bit different, but that's kind of the term that's used. And then we have two branches if preeclampsia develops further. We have HELP syndrome and eclampsia. So HELP syndrome uh, stands for hemolysis, elevated liver enzymes, and low platelets. These are really concerning and show very severe signs of elevated liver enzymes, low platelets, things like that, and then also the central nervous system dysfunction as well. That other branch is eclampsia. So we would see tonic-clonic seizure activity in the pregnant individual, and by trying to diagnose earlier with the hypertension, proteinuria, and organ dysfunction, we're trying to avoid seeing eclampsia develop in individuals. The pathophysiology of preeclampsia is still semi unknown. It's very interesting. Here we have a drawing of actually a very healthy placenta, it looks like from the drawing. Um, where so that's not a great image for preeclampsia because it's really caused by this placental ischemia, hypoxia, and poor perfusion. So as the placenta develops, we need it to grow lots of blood vessels so that it'll perfuse properly, and then get proper blood flow to the fetus, and then in turn, proper oxygenation to the fetus, things like that. So what's been discovered is that when there's placental ischemia, it leads to this multi-system maternal complications, aka preeclampsia. The ischemia actually triggers this inflammatory response in the body. So cytokines and growth factors are released, and these cause all these terrible symptoms such as hypertension and proteinuria, all the things that we've talked about. The unfortunate thing, and we'll kind of talk about in the next slide, is that this reasoning for poor placental perfusion is still unknown. So we know that the cause is ischemia and vasoconstriction. The risk factors are a little bit difficult. We see preeclampsia more common in people with a family history of it, They come into pregnancy with chronic hypertension. They come into pregnancy with diabetes or obesity or kidney disease. And then, of course, we see it in these higher risk pregnancies, such as multifetal pregnancies, and then also when there's advanced maternal age in the mix. When we're looking at signs and symptoms of preeclampsia, we have the signs, which we've talked a ton about: hypertension, proteinuria, all those things. The symptoms are here on this lovely image that's produced by ACOG. People often have a headache. It doesn't go away with Tylenol and sleep and water and all of those kinds of things. Along with the headache, a lot of people will experience blurry vision, vision changes, dizziness, things like that. The upper right quadrant pain, confusion, nausea and vomiting that they weren't already experiencing, swelling of the hands, often the face and feet and ankles. Um, People see shortness of breath. It's concerning because a lot of these things, for example, shortness of breath and swelling of the feet, are really common pregnancy symptoms. And so often people kind of brush them off as like, well, I'm pregnant. So, I'm kind of short of breath when I walk up the stairs. But we're looking for a change in those things. So when it comes to treatment for preeclampsia, it all depends, but most commonly, providers will try to use antihypertension medications to keep that blood pressure at a safer range so that the individual can continue with the pregnancy and let the infant continue to grow and develop. Um, if if there is concern, they will also use convulsant medication. So this is to prevent seizure activity because, of course, seizure activity can be really damaging to the pregnant individual and the fetus. Sometimes delivery of the infant is the best option. Of course, this is, a very long conversation with a provider, and they take into account all the different diagnostic criteria, the age of the gestation of the pregnancy, things like that. But when preeclampsia presents during pregnancy, delivery is the best cure for preeclampsia. And then I have corticosteroids on here because sometimes those will be used if early delivery is necessary, so that they can develop the infant's lungs a little bit, if they're expecting a preterm delivery. So, preeclampsia prophylaxis. We hear in the office, baby aspirin, baby aspirin, baby aspirin. So that is a 81 milligram aspirin once a day. Providers instruct their patients to take this medication starting at 12 weeks of gestation. Basically, aspirin prevents blood clot formation, and so the goal is that it keeps the blood flowing properly to the placenta, and then we can avoid placental hypoxia and ischemia and all those scary things. Along with the baby aspirin, very frequent check-ins. So providers are constantly screening for signs and symptoms at every visit just to prevent misdiagnosis of preeclampsia. And the biggest prophylaxis for preeclampsia is education. So we need pregnant people and their support people, their family, their friends, all of those wonderful people to be educated about the symptoms of preeclampsia. Um, I think, like I said in an earlier slide, so many symptoms of preeclampsia are brushed off as normal pregnancy symptoms. So, making sure that pregnant individuals are really aware of their bodies and in tune with what's changing, what's going on, what doesn't feel good, things like that. And then reporting to their providers or their loved ones that they're feeling that way so that they can get into the office quickly and be treated, treated quickly. And lastly, I just wanted to highlight these three resources. So the American College of Obstetrics and Gynecology, as I talked about earlier, we call it ACOG, is a wonderful, they post lovely journals and research about all sorts of pregnancy um, research, but they have really great information about preeclampsia. There's also the Preeclampsia Foundation, which provides a lot of help and education for pregnant individuals and also their families. And then lastly, the March of Dimes. They are a great organization who does a lot of fundraising and education, uh, especially in the Pittsburgh area. And so I just wanted to highlight those three resources for preeclampsia prophylaxis. Thank you for listening.